What's wrong with Dad?
He refuses to wear his adult diapers, but he keeps having accidents.
Let me handle this.
I'm not wearing those things. If a kid...
Afraid of a sudden cough or sneeze that will cause an accident? Is your bladder just out of control? Until now, you had to wear bulky, inconvenient adult briefs or even a pad, but not anymore. Now there's a new option to control your bladder. Desmopressin will revolutionize how you take back control of your bladder. Desmopressin, whose brand name is also known as DDAVP or Stimate, is a synthetic pituitary hormone used for those with diabetes insipidus, as well as those suffering from nocturnal enuresis or nocturia. But you may be wondering, how does this synthetic hormone work? Desmopressin works by promoting reabsorption of water in the kidneys. This results in an increase in urine osmolality and decrease in urine output. Desmopressin comes in tablet and injectable forms. But for those of you at home who don't have time to mess with taking more pills, Desmopressin also now comes in a easy, convenient nasal spray. But wait, how much Desmopressin should you take? Good question. So according to Mosby's 2023 Nursing Drug Reference Book, for those diagnosed with nocturnal enuresis that are an adult or child over 6 years old, you should take 0.2 milliliters intranasally at bedtime, half in each nostril. And then for nocturnal enuresis, there's also PO route, which is 20 micrograms at bedtime. If your provider has diagnosed you with diabetes insipidus and you're an adult, then your provider may prescribe you with 10 to 40 micrograms intranasally in divided doses, 1 to 4 sprays to be exact. For diabetes insipidus, you can also take this medication IV or subcutaneously. They are both 2 to 4 micrograms a day, but with subcutaneous route, you will take it in 2 divided doses. And for those with nocturia that are an adult between the ages of 50 and 64, the provider may prescribe 1 spray in each nostril 30 minutes before going to bed, 27.7 micrograms for women and 55.3 micrograms for men intranasally. And remember, no water before bed. Now let's consider some nursing considerations. Assess pulse and blood pressure before taking IV or subcutaneous routes of Desmopressin. If using the nasal spray, decrease dosage if patient reports nausea, congestion, cramps, or headache. For those with nocturnal enuresis, make sure to identify how often enuresis is occurring and avoid use in those prone to water intoxication or sodium depletion. For those with diabetes insipidus, ensure to monitor for dry skin, poor skin turgor, and thirst, which can be indications of dehydration. According to Focus on Nursing Pharmacology 8th edition, caution should be used with any known vascular disease because of its effects on vascular smooth muscle. It should also be in caution with epilepsy, asthma, and hyponatremia, which could all be exacerbated by the effects of the drug. According to the National Library of Medicine, some common side effects include headache, flushing, tachycardia, cramps, and nausea. Desmopressin does have a black box warning. Severe reactions can include hyponatremia, which can be life-threatening. According to the research article called Desmopressin and the Risk of Hyponatremia, a population-based cohort study, Desmopressin was associated with a marked increased rate of subsequent hyponatremia, with a rate of 146 per 1,000 people. Here are some tips to keep you safe while taking Desmopressin. According to Medline Plus, Desmopressin should stay in the container that it came in, tightly closed and out of reach of children. Store in room temperature, away from heat, light, and moisture. For nasal instillation, insert the tube into the nostril to instill product. Ensure you have a clear nasal passage before use. Avoid over-the-counter products for cough and hay fever because they may contain epinephrine, which may decrease the product response. Wear emergency ID specifying therapy at all times. Do not use with alcohol because adverse reactions may occur. And if you miss a dose, do not double dose. Desmopressin is covered by 70% of insurance plans and copay of $60 to $90. However, some pharmacy coupons or cash prices may be lower.